Did Amber Heard have facial plastic surgery? We'll take a look at Amber Heard throughout the years and see which facial plastic surgeries she may have had. We'll reveal costs of everything at the end, so stay tuned. In 2005, at the age of 19, you can see that Amber Heard has a very natural looking hairline. You can see that it's not perfectly round, it has some recession into the temporal area, and it has some irregularity at the hairline, and that's very normal and natural. Then take a look at her brow position. The lateral aspect of her brow, the tail, sits higher than the medial aspect or the head of the brow, and that also is a very youthful feature. You can notice here her infrabrow fullness, which is the area just under the eyebrow itself, how it's nice and full and has that youthful type of appearance. Her nose is not prominent, which allows for the focus to be taken away from the nose and for the eyes to pay more attention to her eyes as well as her lips and teeth and other facial features. She has a very youthful heart-shaped face, and she has a great chin and jawline structure. At the age of 20 in 2006, you can appreciate that Amber Heard has a relatively short philtrum, and you can notice that her red lip ratio, the upper to lower lip ratio, is 1:2 approximately. She has good upper tooth show with smiling. In 2007, at the age of 21, I don't see any major change, mostly just different makeup. In 2008, at the age of 22, I'm starting to see some signs of a brow lift. When you compare the lateral infrabrow space, and take a look here on the right side compared to the prior image, you can see that there's more of an opening in that area, that the space there has been increased as far as its height, and that to me indicates that there may be a brow lift here at play. I'm also starting to see signs of lip filler being used to enhance especially the upper lip for Amber Heard. In 2009, at the age of 23, there are no major changes. In 2010, you can see just the great cheekbone structure that she has, and that becomes relevant a little bit later on. You can see the smooth lower eyelid to cheek transition that also changes as we age, but in this image, don't see any major changes occurring. Same in 2011 at the age of 25. At the age of 26 in 2012, I'm seeing some signs of an alarplasty, and this is also called nasal base narrowing, and basically taking in the wings or the ala of the nose to reduce that down. This can be done in two general ways. One is to do a sill reduction, which is the nasal sill getting shortened, and the other one is to do a wedge excision of the lateral ala here. So she may have had a combination of those two to narrow the base of her nose. In 2013, at the age of 27, I'm not seeing any major change. Please make sure to subscribe to this channel. In 2014, age 28, I'm also not seeing any major changes occurring. Same in 2015 at the age of 29. In 2016, age 30, I wanted to point out here that Amber Heard is starting to show signs of aging. You can notice that her cheek complex is starting to descend down. It's starting to fall and go more medial or towards the center of the face. That's what happens to all of us as we age. Also, the tear trough area under the lower eyelid there is becoming more prominent as the cheek complex sags. As we age, there are two general processes that are occurring. One is that there is loss of volume in the face. So there is a gradual atrophy process that's occurring. And it's occurring not just at the skin level, but also the fat, the muscle, and the bone is starting to fall apart to some degree. So that's one. And the other element of aging is that there's descent. There's basically a drop or falling with the gravitational forces that are applied to our bodies at all times. It's causing everything to sag and fall. So those are the two main processes at play with normal aging. In 2017, at the age of 31, you can see here that to my eye, she has more enhanced cheek contouring. And I think that she may have had actually a cheek implant at around this time. Now, some people think that she had a cheek implant a little bit later, like in 2018, but I'm already seeing some signs of a cheek of a malar implant sitting there laterally. It looks different to me than her natural original cheekbone structure. In 2018, at the age of 32, you're seeing here now there's definitely something there in place on the lateral cheek, and it has some extension to the medial cheek, so to me that indicates a cheek implant most likely. Either this was the initial placement or maybe a replacement, an enlarged cheek implant compared to the year prior, who knows. And also I can see that Amber likely has had neurotoxin starting probably in a few years prior to this, and she's continued to use neurotoxin, which is also called Botox, to reduce the wrinkles on the forehead, glabella, crow's feet, those general areas. In 2019, at the age of 33, there are no major changes here. And in 2020, at the age of 34, you can see further signs of aging. So in Amber's case, you can see that the lateral, again, brow, the tail of the brow is starting to fall or descend. The lateral canthus of the eye is also starting to descend down. She has more prominent marionette lines and nasolabial fold lines that are starting to be more obvious as, again, that cheek complex starts to come down and move towards the center. Those lines become accentuated. When you look at her upper to lower red lip ratio, it's now closer to a 1-to-1 ratio. She has increased arching of the upper lip. This to me suggests either a lip lift or a V to Y upper lip advancement. Now, given the lack of visible subnasal scar and the fact that her philtrum really hasn't changed a whole lot as far as its length from her original upper lip area, to me that favors a V to Y advancement. As far as beauty lip standards, there's definitely been a shift over time from the lower lip being the fuller, more robust part of the lip to now having the upper lip and the lower lip become more at a 1-to-1 ratio with one another. And there are some people who even prefer the upper lip being bigger to the lower lip. That is not classic beauty standards, but that is something that we are moving towards in our society today. In 2021, I'm not seeing any signs of major change, and in 2022, at the age of 36, no major changes have occurred to my eye. On the high end, the total of all these procedures is $135,000, and here's the breakdown. Since you like this video, I know you'd love to hear about Madonna and her facial plastic surgery analysis, so click on this card and I'll see you there.